Hey, it's Jessica DaMassa with WTF Health. I'm here at the Together.Health event at HIMSS 19, and joining me right now, I have Omkar Kulkarni. He is the Chief Innovation Officer at Children's Hospital of Los Angeles. So welcome, it's good to talk to you.
Thank you.
Don't often get to talk about pediatrics and innovation, so tell me what's going on in this space. Where are you guys focused on? Is it the same stuff as a regular hospital system, or are you guys taking a different look at things because of the fact that it's a younger population that's involved?
Yeah, so pediatrics is interesting. So it's different than the traditional adult space just because we have their kids. And so there's some other regulations, some other things to consider because you're not only taking care of the kid, but you're also taking the child, but you're also taking care of the family too, the parent. So it's a little bit more nuanced to the conversation we were having earlier. I think taking care of the family and taking care of making sure they actually are taken care of is really important. But we focus on the same things that I think a lot of other hospitals are looking at, namely access, namely making sure that they have high quality care and great patient and family experience. And something I'm personally interested in, which we're going to talk about here at Together.Health, is around social determinants of health and how we can really help the child be healthy, not only in terms of the health care they receive, but everything around their health care that makes them healthy.
Talk a little bit more about that because, I mean, Los Angeles is a huge city and Los Angeles County is enormous. And there are, the disparities between like the very, very wealthy and then the very, very poor in those places. And also, in terms of, how that impacts the care that they receive. So talk to me about what you're focused on specifically in terms of social determinants of health.
Well, so a couple things. So there's 2.5 million kids in LA, which is putting that into perspective. That's more than the number of human beings in Boston. So it's a large number of kids, and we have to take care of a lot of them. So we're lucky to take care of a lot of them. The other challenge that exists with kids is from a healthcare perspective, a lot of them are on Medicaid. More than half the kids in this country are on Medicaid because of the way the insurance system works, which is great, but it presents some challenges in terms of innovation and resources.
Is it really more than half?
Yeah, it is. And so that's... Yeah, so that's part of the challenge. The other piece that is interesting from the social determinants perspective, there's in LA, there's more than 60,000 kids are homeless. Or on the street. There are kids that 1 out of 5 kids doesn't have a secure source of food. There's kids that have mental health issues that aren't having access to mental health providers and professionals. And so we're trying to find ways to use technology to bridge some of these gaps and find ways to make sure that these kids are not only getting amazing health care at CHLA, which they absolutely are, but then even beyond that, as they're going into the community and getting access to health care, that they're actually having access to these social and emotional determinants as well. And the other thing that I'll point out is California and LA particularly has a very large Latino population, Latinx population. More than half the kids in California are Latinx, and about 60% of the kids that we take care of are. And so there's some specific challenges, particularly with that community, not only in terms of language and some cultural differences, but just broadly in terms of making sure that they have access to the best elements of both healthcare and all those social determinants that I talked about.
It's so interesting. I often forget too about the Latinx population and how huge that is in Los Angeles and how that adds another layer of complexity to getting care, is even just with health literacy. Are you even understanding as a parent what's going on in the first place?
I think about 40% of the families that come through our doors, at least somebody in that family is a monolingual, non-English speaker. And so managing things around language and culture. We provide instructions to patients about what they should eat or their families, but the reality is they may not have that kind of food in the kitchen because from their culture, that's just not what's there. And so when you've got one child who's got, an illness, but 5 siblings or 3 siblings and the family's trying to manage the entire family, we need to think about that family as a whole when we're providing care to them, because it's not just about providing care to the one kid, it's about providing care to the family.
Okay. So talk to me, I guess, a little bit about how you, as somebody who's a chief innovation officer of a health system that's focusing on this in this population, and you're not alone. I'm sure we have similar situations, either of smaller scale, elsewhere in the country. So how are you with your CIO hat looking at innovations to bring in? Because it's like, especially within health systems, I think we often think, okay, great, so we'll have an app that's bilingual. It does not begin and end with a digital health app that helps translate things. So talk to me about some of the real things that you're looking at, some of the real technologies that you're looking at and solutions that are going to innovate in this space and really be transformative to the care that these people are receiving.
Yeah, no, and you're right. It's a problem that's not only at CHLA. This is a challenge that we're facing everywhere about how we care for the child and the family as a whole and all these different factors. We're partnering. I mean, we're here at Together Health today. We've been part of Together Health since its inception, and the way we're doing this is by partnering with other people. So partnering with ecosystems in LA, around the country, partnering with other tech companies, partnering with other people that are commonly interested in the same problems that we have. Yeah. My belief is in healthcare, particularly in pediatric health, we can't be alone. We can't go at this by ourselves. We have to partner with the ecosystem, whether that's startups, investors, payers, tech companies, entertainment companies in LA, others that can help us really solve some of these problems together and collectively.
Awesome. Well, thank you so much for joining us. It's a pleasure to hear your perspective. We don't often, like I said, get to hear about pediatrics. One last thing I do want to ask you before we break away here is just, do you have any one area that's really hot for you in terms of innovation as far as peds is concerned?
Yeah, so we are particularly focused right now on virtual reality, augmented reality, and gaming. So we think that there's a lot of applications both from a digital therapeutics side, a patient-family experience side, and also a simulation and training and education side. There's so many things that we could do in this space. And kids are digitally native at this point. Many of them use games and virtual reality and augmented reality for a lot of personal use. And so if we can find healthcare applications for them, we think there'd be a lot of potential opportunity.
Awesome. I'm glad I stuck around to ask that one last question. All right, thanks so much, Omkar. I'm Jessica DaMassa with WTF Health here at the Together Health event at HIMSS 19. Thanks so much for joining us.